We continue then with the principles of musculoskeletal ultrasound, and the next structure that can be evaluated are the joints, keeping in mind that ultrasound is not an exam for intra-articular identification. Joints can only be evaluated, let's say, in a tangential or partial way. For example, we can identify cartilage in certain areas, such as the knee. This is a trochlea where, clearly, if we already identify a hyperechoic pattern that corresponds to the trochlear bone, with posterior acoustic shadowing, the cartilage, due to its high liquid content, will appear as an anechoic image. There are different structures that we already recognize above, but basically, in all joints, we are going to identify bone and cartilage. There are even classifications to identify certain cartilage injuries in some anatomical segments. So, this is a trochlea with a very hyperechoic, well-defined bony image, alternating with a layer of fluid above it, which corresponds to the cartilage. Let's look at another joint in this case. A knee, we would be evaluating just this segment, the femoral condyle, the tibia, identifying the joint, two bony structures, a capsule, and there are some ligamentous structures that we've already learned to recognize, twisted, rich in fibrous tissue. This is the meniscus, which is a fibrocartilaginous tissue that is hyperechoic. So, the identification of the structures in the joint are anatomical, which allows us to identify joints.